How did you start to kind of come into this mindset of like, oh crap, I just had my breasts removed, but I think that I actually want to still be a female?
I was debating, am I going to kill myself or not? And I decided I would try to live. And if I was going to live, that meant that I needed to take some kind of responsibility and start to make some changes. So I had a psychological evaluation. I was diagnosed with PTSD from the child abuse, but also from the transition itself. These practitioners were like, yeah, you have PTSD from getting the surgery, from having this identity crisis. It was surprisingly very easy for me to accept it at that point because my reality had a complete paradigm shift where I went from fighting reality and fighting the abuse and trying to run from it or blaming myself and realizing this was not my fault at all. This was never about me. This was about the environment I was in. This was about my abuser abusing me. This wasn't actually something wrong with me. And that's what helped me to then realize it was the same thing with the trans stuff. The trans stuff was just a maladaptive coping mechanism for the abuse and the trauma. So then I detransitioned within a few months because I realized that I was just a traumatized woman. I would always be female, and that acceptance actually brought immense peace. I realized that I could have forgiveness for my female body for just enduring the pain of that abuse. There was nothing wrong with it that needed to ever be fixed.